Well, joining us with more on the connection to the pandemic is Dr. Jared Euro, Chief Clinical Officer, Clinical Psychologist Supervisor at the Department of Health, Alcohol and Drug Abuse Division. Of course, Doctor joined us just a bit ago talking about stress, anxiety, and the effects that this pandemic has had on our mental health. He gave us some great tips on how to alleviate that. If you missed it, we'll have the link and the video on our website at KHON2.com. But Doctor, let's talk a little bit more about the correlation. How exactly has COVID affected mental health across the nation?
Well, it has had quite the impact, and this is something a little bit outside of the normal. So some of the things that we have seen during this whole pandemic are actually temporary or permanent layoffs from work. We've seen people experiencing a lot of financial strains, personal impacts or losses directly due to COVID. We've seen, unfortunately, the rise in illness or death counts, which of course has been very tragic. We've seen ourselves move from offices to a telework environment, so where we're used to having people around us, now we've had that loss of social contacts. For the kids, the keiki, it's been difficult as they've moved from schools actually to having to do homeschooling. And I think for all of us, we have found ourselves living in an increasingly violent and disruptive climate. There's been a lot of political divisiveness, unfortunately, and often these are about, well, should people wear masks or not wear masks? So the impact has actually been quite huge.
Yeah, and of course, we've felt it. We know many friends and families who have been struggling as well. What exactly are the numbers, though? What are some of the statistics related to the pandemic?
Well, the American Psychological Association actually did a survey in February of this year. And since the start of the pandemic, they found a number of statistics. And I have to say, a number of them are quite startling. So 61% had undesired weight changes. 31% reported mental health deterioration. 54% of healthcare workers or law enforcement have relied on unhealthy habits to cope. 29% said their mental health has worsened. 75% they could have used more emotional support. People of color have reported unintended physical changes. More than half said they do not feel comfortable about going back to pre-pandemic life. So for those of us who have thought about maybe stepping onto a plane, going out to eat to a restaurant, we've all had a little apprehension about that. And 49% said they feel uneasy about adjusting to in-person interactions once restrictions are lifted. So this has really impacted all of us.
Yeah, and when you talk about some of those, for me, I think, it seems to make sense. It wouldn't be natural for many of us after changing all this year and, of course, still not wanting to get sick to just go back to normal. So I think a lot of these aren't necessarily unusual. What would you say? Are these reactions to the pandemic normal?
Well, they really are. I mean, this is one of those once in a century situations. If you go back to 1918 and what was called the Spanish flu at the time, that was really a major event. So we are having a reaction to one of those events that can be considered global. So a lot of what we are experiencing, a lot of the symptoms that I talked about really in the last segment, these are things that have really affected a large number of us, if not all of us in some way. So nevertheless, I think it's important to realize that while all of us have been affected by a very, very large event, it's still important that all of us in some way find some way of coping and then doing things that are going to build up our resources and resilience.
Right. And there are so many resources out there. Again, a big majority of the nation has been negatively impacted by the pandemic. For those who are hoping to reach out for help or maybe have a family member or friend that they're hoping to get help for, where can we go? What are those resources?
Well, wonderfully, we have both local and national resources that are available. So the first one I'd like to talk about, which is actually offered through our Hawaii Department of Health, is through Hawaii Cares. And the number to reach Hawaii Cares is 1-808-832-3100. And they're available to offer people who can then go ahead and make referrals to connect you with the resources that people are going to need. Counseling and other resources to get support. In addition, there's also SAMHSA's national helpline. SAMHSA is through the United States Department of Health and Human Services. Their phone number is 1-800-662-HELP or HELP. And then lastly, there's also the National Suicide Prevention Lifeline. Their number is 1-800-273-8255. I cannot emphasize, no matter who you are, it is absolutely important to reach out. A lot of us like to think that we should be able to cope and handle anything, but again, recognize this has been a pandemic, this has been difficult. All of us, no matter how healthy we may feel we have been, we often need resources and the supports in order to get back to doing what we do best.
Right, and as we just learned, again, it's the majority of us. So don't feel alone if you are feeling this stress and anxiety or anything that was more negative mentally towards the pandemic, because it's something that a lot of folks are dealing with. But again, you are not alone. There are great resources. Hawaii Cares, High Cares is a great one. We'll have all of those websites, phone numbers that Doctor just listed on our website as well at k22.com. But thank you so much, Dr. Euro, for joining us this morning.
My pleasure.